Welcome back. The Central Coast has been hit hard by the Omicron surge like the rest of the country. Joining us now live via Zoom is San Luis Obispo County Public Health Director Dr. Penny Borenstein. Thank you for being with us once again. Now, in the last week alone, San Luis Obispo County has recorded nearly 4,900 cases in 1 week. That's more cases than the previous 2 months combined. We're getting some news about infections beginning to slow down in some parts of the country, but that sure does not seem to be the case here in SLO County.
Yeah, we're certainly watching what's happening in other parts of the country and hoping that we'll have the same number of weeks or less than we've seen elsewhere, but we're not yet turning the corner like they are on the East Coast.
When we spoke last week, you confirmed that Omicron is generally less severe than other strains of COVID, but it spreads so quickly. And 5 more deaths were announced in the county just yesterday. Who are the people that are being hit the hardest by Omicron?
Yeah, so certainly people with medical vulnerabilities, but primarily this continues to be a disease of those who remain unvaccinated. Only 7% of all of our deaths from the beginning are among people who had any full vaccination. And that means the other 93% of our nearly now 400 deaths are in people who have not been vaccinated. So that really, it is a life-saving medicine. And, you know, I know that there are people who strongly oppose, but there are people who just haven't gotten around to it, or people that are still waiting to see what the impacts are. What I'd like to point out is that there have now been nearly 10 billion doses of this vaccine administered globally, and over 500 million in the United States. So with very, very few really serious adverse effects. So I know that we continue to harp on this, and people are probably tired of hearing about it if they haven't yet gotten vaccinated, but really that is the thing that is going to save your life most commonly.
Do you have any advice for family members or friends of people who have been hesitant to get vaccinated about things that they may be able to say to them, things perhaps that you've heard have been effective at getting a message across?
Well, what I do recommend to people is that they talk to their doctors more so than friends. Look at reliable sources like the Centers for Disease Control. Listen to these numbers that I'm telling you about. 9.95 billion doses have been safely administered with rare adverse side effect. I know people do talk about people dying after vaccination. Those are misleading numbers because people do die every day, and they happen to be sometimes after you've gotten a vaccination. But the actual numbers of people who have been caused real harm or numbers of deaths from the vaccine are very few and far between. So it is a safe product, and it is very effective in saving lives and saving you from getting hospitalized, very much so. That's something, if you know any healthcare workers, if you love your healthcare workers, they are just feeling absolutely besieged with this particular surge that we're seeing. Our hospitals are struggling even more than in previous surges because the staff are also getting sick now, and they just don't have the manpower or the womanpower to keep going, providing the care that they need to. So with that, they've had to cancel a lot of elective surgeries. They have people sitting in emergency departments who are waiting for admission beds. It's not a pretty situation out there right now.
Treatments. I saw a report today that some of the monoclonal antibodies that have been effective are not working that well against this variant.
That is true. So some of the earlier products, like REGEN-COV, for instance, that's one that became known when our last president had received it. Many people have received that. There's another product that have now actually been paused. They're not available at this time because they're not effective against this particular strain. But there are other monoclonal antibodies that are available, as well as antivirals. The problem at this time is that there's so few and far between that we really have to triage and very carefully determine which individual people get these doses, and they right now are only available to people at the highest risk. That means people over age 65, but also they have to have underlying immunocompromising or serious health conditions to be able to get a dose of treatment at this time. We hope that that is going to open up, in the near term, but right now it's limited. So people should ask their doctor if they can get a dose of treatment.
So treatments are limited, but the vaccine remains widely available. Dr. Penny Borenstein, San Luis Obispo County Public Health Director, thank you very much for joining us.
Thank you.